Travel and Things, in association with Rugged Wear, Real People, Real Clothing, Real Solutions, presents In Conversation With. I'm your host, David Batsoffen, and in this series, we're looking at depression that has been induced by COVID, and my guest is a clinical psychologist, Ruth Ancer. Ruth, welcome to you once again. The series so far has been fascinating for me. I hope the viewers are finding it equally fascinating and are learning from what you've said over the past few weeks. So let's have a look today at the context of COVID, and can it induce depression? And is it a different type of depression to the ones that people was struggling with before 2020?
So there are two levels to this. One is depression following a COVID infection and
Right.
a COVID illness. And the other is depression around the pandemic and what resulted from the pandemic. So we are seeing people who've struggled with COVID, and even if they're better physically, they are still they're depressed. And it's hard to sometimes work out, because part of depression is fatigue, but part of the consequences of having COVID is fatigue that takes a long time to resolve. So sometimes it's difficult to work out what is physiological in terms of the feelings that you have, the lack of motivation, the lack of energy, and what is a result of a mood disorder, which has come from the COVID. So, I mean, I think that it is quite hard to work out, but what's really important is to recognize when you are struggling with the symptoms of depression. And depression is not about just feeling sad or feeling despondent at times. It's when those kind of feelings and symptoms start interfering with your functioning. So when you cannot sleep, when your eating habits are disturbed, when you start thinking about death, when you start feeling helpless and you have a sense that you lose the sense that things can get better, you don't feel that there's any optimism. And when you start feeling worthless, and those feelings become more, those are the dominant feelings you have, we normally say within a 2-week period or longer, then we're looking at a diagnosis of depression. And I think that the way the depression presents isn't different from before, but there are a number of additional triggers that we're seeing. And that is the anxiety, that is a lot of people lost work, lost jobs. A lot of people's financial situation changed. Suddenly people had to work from home, which is wonderful for some people. But for a lot of people, their homes weren't set up to have private space. And then there's, if they're working online, there was data, Wi-Fi, receptivity, those kind of connections, which are often out of your control. So for a lot of people, those kind of changes brought about a sense of isolation. And also it took away, and I think what's important is a lot of what we do to keep ourselves mentally fit is our recreational physical activities. So going to art classes, or going to soccer, or going to gym, or the park run that a lot of us enjoy doing on Saturday mornings. All those kind of things suddenly came to a halt. So things that we're dependent on to have a sense of connection to the community, for health reasons, for stimulation, for enjoyment, for pleasure, suddenly stopped. And for a lot of those things, they're starting again. But for many people who were running that, they financially were ruined and couldn't restart it. So there was we lost a lot of what we normally have as protective factors against mental illness and against depression, anxiety. And instead we had a lot more stresses. So the stresses certainly outweighed our resilience. And that's why people, now that we've got high levels of protection, we understand more what we need to do in order to still engage with other people, but still keep ourselves safer. So things are starting to open up. But what we lost in the meantime, especially people who were predisposed to anxiety and depression. So new people who did not have a history have presented, but really vulnerable populations, such as those who were vulnerable and had predispositions or past histories of depression and anxiety were most at risk. And also youth and young adults. You know, the time when usually it's very social and people are going out and people are studying and having campus life. And suddenly, you know, my nephew said to me, it's like I've been doing correspondence, even though I'm supposed to be on campus, I'm supposed to be in lecture halls, and it's like I'm doing it by correspondence. And, you know, to think back at how rich those campus days and what that gave those of us who are fortunate enough to be able to go in our day, it's quite incomprehensible. You know, I've got some clients who are saying to me, I'm finishing my degree this year, and I spent 3 weeks on campus.
Yeah. What people who are watching this, Ruth, and go, hang on a second, some of those symptoms I feel are relevant to me. What should they be doing in order to give themselves peace of mind? You know what it's like. If you read a book, a medical book, all of a sudden, whatever is in the book and you're reading, you've got the symptoms. You're going to die of some unimaginable disease that only occurs once in a millennium, but because you've read about it, you've got it. And symptoms are easy to go, wow, I think that applies to me. Just listening to you now, I was going, hang on a second. I've had some of those symptoms. Maybe I should be seeing you as a client. What can they do, A, to just make things a little bit easier for themselves, but B, what sort of help should they be seeking?
I think it's also important to distinguish. Sometimes we can feel those symptoms when we're grieving, when we've had a loss. So it doesn't mean it's a depression that needs treating. It's a normal reaction to losses. But where you find that, as I said, where it is impacting, so just this dog's tail shows how much things have changed, because you would never have seen a dog's tail in an interview before, but you know, these are lives that have changed working from home. But I think that if you're worried and if you are not able to function as you used to, if you're not able to get yourself doing the daily tasks of living, if you find that your level of pleasure in activities has reduced, then it's worth, first of all, speak to supportive people around you. I think our support systems, our families and friends and people who care about us, or, you know, the EAP at work, if you've got that, that's a start. Otherwise, to reach out to organizations such as SADAG, the South African Depression and Anxiety Group, they've got counselors who can help you determine whether you are struggling with depression. And if so, there are counselors, there are organizations if you can't afford privately, but otherwise go and make an appointment with someone. It can be a one-off, and just go talk through it to see whether there's extra help you need. In times like this, if you are struggling with the depression, there are things that can be done in terms of reaching out. Physical exercise is marvelous, yoga, meditation, therapy, and of course, there's also medication that can be very useful when you're needing more intense treatment.
Great stuff. Ruth, thank you so very much. A very interesting talk today. I hope the viewers have enjoyed it as much as I have. Next week, we'll have a look at, does COVID make us become dysfunctional? I think you've answered some of that already, but we'll take that a little bit further in the next episode. Thanks very much once again for being with me. I've been chatting to Ruth Anser, who's a clinical psychologist. Until next time, bye for now.